Hello and welcome to the Pace Hospitals podcast. Today we will be taking a closer look at vascular malformations. These are complex conditions that can affect blood vessels anywhere in the body, and understanding them is a key to early diagnosis and effective management. Joining us today, Dr. Lakshmi Kumar Chalamarla, an expert in vascular anomalies and interventional care with extensive experience in diagnosing and treating vascular malformations. In this episode, he will explain what vascular malformations are, discuss their types and causes, and share insights on the symptoms, diagnosis, treatment options, and preventive tips for patients and their families. Dr. Lakshmi Kumar, thank you for joining us at Pace Hospitals High Tech City. Let us start by understanding what are vascular malformations.
Hello, I am Dr. Lakshmi Kumar. I am a consultant interventional radiologist in Pace Hospitals, Hyderabad. Today we will discuss about a common topic called vascular malformations. Vascular malformations are like birthmarks or swellings which are usually present at birth, and they are composed of blood vessels.
So, doctor, what are the different types of vascular malformations?
There are many different types of vascular malformations, but the common ones are three types. They are named after the type of blood vessels they contain. One is the venous malformation, which contain the veins, and the second one is the lymphatic malformation, which contain the lymphatic vessels, and the third one is arteriovenous malformations. They contain both arteries and venous blood vessels. As we all know, arteries are the blood vessels which bring blood from the heart to the other parts of the body, and veins are the blood vessels which bring the blood back from the parts of the body towards the heart. What the lymphatic vessels do is they bring the excess fluid in the tissue and the debris and sometimes fat from the intestines towards the heart. So these are the functions of blood vessels, and if these blood vessels, any of them is affected, then we get these venous vascular malformations.
Doctor, what are the causes of vascular malformations?
Vascular malformations are generally due to the abnormal development of the blood vessels. So most of them are present at birth and they occur by chance. Only in rare cases they can be familial, means they are inherited and they run in families. Most of them are sporadic, means they occur by chance. Sometimes the vascular malformations can increase in size during illnesses, or if there is any injury, or during any hormonal changes, like during the time of adolescence or pregnancy, they can increase in size.
Dr. Lakshmi Kumar, what are the symptoms of vascular malformation?
Vascular malformations can be asymptomatic, means there are no symptoms, or they can be very symptomatic. So they can occur anywhere in the body, from head to toe, anywhere in the body, all organs can be involved. So the vascular malformations symptoms vary with the type of the organ that is involved. If they are present in the skin, they can cause cosmetic problem. They can have different colors like red, black, purple, brown, or bluish color. Or they can be present as a swelling in the skin, and they may cause ulceration of the skin, means a wound in the skin, and they can lead to bleeding from that wound. Excess bleeding can lead to anemia also. If they are present in the brain, they can lead to symptoms like headache, seizures, means epilepsy or fits, or they can cause a weakness in the muscles, gait disturbances, means there is a disturbance in the walking pattern, or they can cause vision defects, means eyesight may be defective, or your speech may become defective, and also it can cause problems in understanding the other person's speech, or thinking problems, or other sensations like tingling, numbness can also occur if there is a brain vascular malformation. Similarly, if they are present in the chest, they can lead to vomiting of blood, or vomiting in the cough. While you are coughing, you may get blood in your cough, and also they can lead to decrease in the blood saturation levels. If they are present in the abdomen, they can lead to abdominal pain. And if they are present in the intestines of the abdomen, they can cause blood in the stools, means blood in the motions. And if they are in the urinary system, they can lead to blood in your urine. If they are in your muscles or in your joints, they can lead to muscular weakness or joint pains. So these are all various symptoms they can cause depending upon the location where they are present in the body.
Can you explain diagnosis of vascular malformation?
Most of the vascular malformations, they can be seen during the physical examination. Most of the times, patient or patient relatives notices this vascular malformation. There is a discoloration, focal discoloration, or a large discoloration of the skin. So they will come to the doctor. So apart from visual physical examination, we do some other tests to confirm whether it is vascular malformation or is there any other thing that is causing this thing. So we do routinely imaging tests like ultrasound or CT with contrast, CT angiography or MR angiography or a direct DSA angiography. What we see in this angiography is there any, what is the type of vessel that is present in this vascular malformation, the artery which is supplying to this vascular malformation, where it is coming from, and the vein which is draining this vascular malformation, where it is going. So these are the things that we look in an imaging test. Also in DSA angiography, what is DSA angiography means, in this test we do, it's a minimally invasive test. We insert a small catheter plastic tube into the artery or vein and we inject some dye called contrast. By the help of this contrast, we can see the vascular malformation very clearly compared to CT or MR, and we can also see clearly what is the artery that is supplying and where is the vein going to. So similarly in this DSA angiography, we can also treat the condition at the same time. So these are the advantages of DSA angiography. Apart from these imaging tests, sometimes we may require biopsy in confusing cases. Sometimes these vascular malformations can mimic other tumors or other swellings. In those conditions, we may require a biopsy. Means we take a small sample with the help of a needle from that area of abnormality and we send it to the lab to know whether it is a vascular malformation or is there any other condition. Also, this biopsy may be useful in some conditions to look at the genetic makeup of the malformation. Means, is there any genetic condition involving in this vascular malformation? Any genetic condition causing this vascular malformation? To rule out that, we may order genetic test on this biopsy sample.
Doctor, could you explain what are the complications of vascular malformation?
So, if the vascular malformation is in the brain, it can lead to bleeding in the brain or it can cause brain stroke. That is a serious life-threatening complication. Also, if there is a large arteriovenous malformation which has high flow, very high flow, then it may cause congestive heart failure. Means if there is excessive load on the heart due to increased flow into the vascular malformation, the heart may get tired and it can lead to heart failure. That is one serious complication. Also, if the venous malformations are very extensive and the flow of blood within the venous malformation is slow, the blood can get clotted. If this clotting is very much excessive, then it can consume all the clotting factors in the blood. This will lead to bleeding in other parts of the body. Means even if there is small trauma, it can cause too much excessive bleeding because the clotting factors are all used by this venous malformation. This is called conjunctive coagulopathy or local intravascular coagulation. So this is one more life-threatening complication due to vascular malformations. Also, venous malformations can lead to one more complication called pulmonary thromboembolism. If there is a clot in the venous malformation, it can break and go into the deep veins, and from there it can travel to the lung veins where it can block the lung veins. This condition is called pulmonary thromboembolism.
Dr. Lakshmi Kumar, what are the treatment options for vascular malformations?
So the vascular malformations treatment depends upon where is the vascular malformation located, which part of the body, what are the symptoms that the patient is facing due to vascular malformation, what is the age of the patient, and also depends upon the type of vascular malformation, what is the type of vascular malformation. So various treatment options that are available are sclerotherapy. This is one of the commonest treatment that we do. What we do in sclerotherapy is under ultrasound guidance, we see where is the vascular malformation located, and we inject a small needle into that vessel, and then we inject a medicine called sclerosant. This sclerosant irritates the inner lining of the vessel, and it causes clotting of that vessel, and it will permanently block that vessel. This clot will not be as much larger compared to the native clots which form due to the complication arising from the vascular malformation. So this will permanently block the vascular malformation. Other treatments are embolization. If there is a high flow within the vascular malformation, we need to tackle that with embolization apart from sclerotherapy. What we do in embolization is we insert a small catheter or a plastic tube into your artery or vein under X-ray guidance and ultrasound guidance. We take that catheter to the vascular malformation. Mostly this is done in the arteriovenous malformation. So we take that catheter through the artery or vein, and then we inject some glue particles or coils or other particles to block that vessel. So this method is called embolization. Other treatment options are laser therapy. Laser therapy is generally done for superficial lesions which are present in skin or in the mouth. They can decrease the pigmentation and they can decrease the symptoms. The other treatment is surgery. So if the vascular malformation is amenable for surgery and it is localized, we can remove that vascular malformation using surgery. This surgery may be preceded by embolization or sclerotherapy to decrease the amount of bleeding during the surgery. So the treatment of vascular malformation is done by a team of doctors. Generally, it involves interventional radiologists and the plastic surgeon, a pediatric surgeon, orthopedic surgeon, neurosurgeon, depending upon the body part which is involved. So it's a teamwork.
So, doctor, what are preventive tips for vascular malformation?
As the vascular malformation is a genetic condition, sometimes it is present at birth. There is no preventive thing that we can do to prevent this vascular malformation. But one thing we can do is, if the vascular malformation is genetic, we advise the couple to undergo genetic counseling with geneticists to decrease the chance of passing this vascular malformation to their children. So that is one thing that we can do to decrease the incidence of vascular malformation.
What is the prognosis of vascular malformation?
These vascular malformations, they generally respond well to the treatment. We generally treat those whenever they are symptomatic. If they are asymptomatic, we don't treat them. So if they are causing more symptoms in a particular part of the body, we treat only that part of the body to relieve the symptoms. So one more unfortunate thing is, even if we treat some blood vessels, they will get blocked, but again they may recur in the future. So patients will require regular follow-up. So they have to do their own self-examination. If the malformation is increasing in size, they may have to come to the doctor again for treatment, for other session of treatment.
Dr. Lakshmi Kumar, is genetic testing required for vascular malformation?
As we have discussed, most of the vascular malformations occur by chance, means they don't run in families. So most of the time occur by chance. But sometimes they can occur in families, means there is a genetic defect and parents can transmit this malformation to their children. This can pass from the families. So in those conditions, we may require a genetic testing. So some conditions like hereditary hemorrhagic telangiectasia, Klippel-Tenoni syndrome, blue rubber blood nevus syndrome, and Parker-Weber syndrome. These are some of the examples, some conditions in which the vascular malformations are hereditary and they run in families. In those conditions, we advise genetic testing to confirm that this is this syndrome. So also the use of genetic testing is nowadays we have advanced medicines. If we detect a particular genetic defect, we can target that gene and we can give that medication to decrease the vascular malformations symptoms or to decrease the size of vascular malformations.
So, doctor, are vascular malformation hereditary?
So most of the times the vascular malformations are not hereditary, means they occur by chance during birth due to abnormal development. But rarely they can be genetic, they can run in families. So rarely they are genetic, most of the times they are sporadic or they occur by chance.
Dr. Lakshmi Kumar, is vascular malformation permanent?
These vascular malformations are unfortunately they are we can say permanent because most of the times they are present at birth and they grow slowly along with the child. They increase in size proportional to the child growth. Even if we treat them due to symptoms, we need to treat them if they are more symptomatic. Even if we block some vessels to decrease the symptoms, after some time they may recur again. So unfortunately, we can say these are permanent.
So, doctor, some people might wonder, are vascular malformation considered tumors or are they something different?
Vascular malformations are different from vascular tumors. Vascular tumors examples are hemangioma, Kaposi's sarcoma, hemangioendothelioma. So the difference between a vascular tumor and a vascular malformation is the vascular tumor grows rapidly compared to the child growth. Means if a child limb has grown 1 centimeter, the tumor may go 3-4 centimeters. So whereas the vascular malformation will grow proportional to the growth of the child. And some vascular tumors like hemangiomas, they can spontaneously decrease in size and they may disappear on their own. Whereas this vascular malformation, they will eventually require treatment. They will not disappear on their own most of the times.
Is vascular malformation a birth defect?
As most of the vascular malformations are present at birth, so we can call them as birth defect. Yes, they can be called as birth defect.
Doctor, how common is a vascular malformation?
Vascular malformation are seen in 1 to 4% of babies. Means if there are 100 babies born, we can see vascular malformation in 1 to 4 babies. Among these vascular malformations, venous malformations are the most common type of vascular malformations.
Is it safe to get pregnant with a vascular malformation?
So there are two issues during pregnancy regarding vascular malformation. One issue is whether the vascular malformation present in the mother can it get transmitted to the baby. That is one issue. Second is the vascular malformation present in the mother, can it increase in size and can it cause more problems during pregnancy. That is second issue. Regarding first issue, whether the vascular malformation can be passed into the child. So to answer that question, we need to do some genetic tests and you need to get counseled with a geneticist. So there are some hereditary syndromes like hereditary hemorrhagic telangiectasia, Klippel-Tenoni syndrome, Park-Weber syndrome, Sturge-Weber syndrome. These can be transferred to the child from a parent. So to decrease the chance of transmitting this condition, you need a genetic counseling. Regarding second issue, whether the vascular malformation can increase in size during pregnancy, can it lead to more problems during pregnancy? To answer that question, we need to assess the vascular malformation before you are planning for pregnancy. What is the extent of vascular malformation? How many malformations are present in the body? Where are the locations where they are present? So we need to assess all these things before you are advised for pregnancy. So if they are larger in size, if we feel that they can increase in size during pregnancy and they may lead to bleeding, we need to tackle those vascular malformations before pregnancy. We will do some sclerotherapy or embolization, or we may advise some compression therapy to decrease the chance of they becoming more aggressive during pregnancy due to hormonal changes. So it is safe to get pregnant with vascular malformation. It's not a contraindication. Only thing is you need to take some precautions before planning pregnancy. You need to consult doctor, and you may require treatment of those vascular malformation before continuing with the pregnancy.
Could you explain difference between vascular malformations and hemangioma?
Previously, the vascular malformation and hemangioma, the terms were used interchangeably. Nowadays, with proper terminology, we are calling each vascular malformation with a different term. There is a very well established classification. So the hemangiomas come under vascular tumors, which is different from a vascular malformation. So both come under the common term called vascular anomaly. So vascular anomalies include vascular malformations and vascular tumors. And under the vascular malformations, you get the hemangioma. So hemangioma is a type of vascular tumor. It's not a vascular malformation. So the difference between a tumor and a vascular malformation means a vascular tumor will grow rapidly in compared to the child growth, whereas a vascular malformation grows in proportionate to the growth of the child. And one more difference is the most of the hemangiomas, the good news is they can disappear on their own with the increase in the age of the child. Whereas most of the vascular malformations, they won't disappear, and eventually most of the vascular malformations, they require treatment. Whereas most of the hemangiomas, they don't require treatment. Only some persistent hemangiomas, they require treatment. So this is the difference between vascular malformations and hemangiomas.
Thank you, Dr. Lakshmi Kumar Chalamadla, for being with us today and sharing a crucial information about vascular malformation with our listeners. I hope this conversation empowers everyone because knowledge and support are powerful tools in managing vascular malformations. Remember, every small step in understanding your condition counts. Every challenge is an opportunity to improve, and every day is a reminder of your resilience. If you have any further questions about vascular malformation or your vascular health, please do not hesitate to consult a vascular specialist or your healthcare provider. Remember, while living with a vascular malformation can present challenges, it does not define who you are. With the right information and support, you can take charge of your health and well-being. We will see you soon with another episode on Pace Hospital's podcast. Until next time, stay informed, stay proactive, and take good care of your health. Thank you.